the Australian's largest clinician syndicate. Over the last few years, you have already invested $14 million across 32 healthcare companies. And the crazy stat here for me is that you have 0 failures in the portfolio itself, which is genuinely impressive, with 2 exits already.
Well, health tech founders were really struggling to get access to investors through traditional methods, particularly because a lot of VCs were quite nervous about investing in healthcare. You've got regulatory barriers, you have reimbursement queries about whether there would be a business model. We have complex systems in terms of how the system is funded, but we bring a governance lens that helps people do it in a safe way that doesn't harm people. And I think it's hard sometimes for other investors who are a bit more agnostic about industry to understand how you navigate building in health tech, because you've got to be fast, but you've also got to be safe.
You're not just being the signal here, you actually are able to plug those founders into the right networks to even help them with the success.
We're already aware of their product, or we know how their product is going to fit in the ecosystem before they even pitch the product to us.
Yeah. What do you do differently in the selection stage? I feel like no other VC would be able to even claim that no companies have died in their portfolio. I am Michael Batko, and I've spent the last 10 years investing in over 200 companies, and I am excited to work really closely with the Medical Angels team as they are taking the Australian's largest clinician syndicate and making it into a formal $40 million fund. We've got Dr. Amandeep Hansra, trained GP, who was a principal at Main Sequence, which is CSIRO's venture fund, chief clinician advisor at the Australian Digital Health Agency, and co-founder of a community of 25,000 healthcare professionals, as well as Dr. B, who is an emergency clinician, neuroscience PhD, published in Science and Nature, and manages multi-specialist clinics and has built himself a community of 28,000 clinician investors. Over the last few years, you have already invested $14 million across 32 healthcare companies. And the crazy stat here for me is that you have 0 fatalities, or like 0 failures in the portfolio itself, which is genuinely impressive, with 2 exits already. It is such a special thing in the venture capital industry. So if you are a doctor and you're thinking about the other side of being on the side of innovation, of investing into companies and startups, this conversation is perfect for you. So let's kick it off with the story of how the two of you met. Where did this all get started?
I think you should start with me, because you reached out to me first.
I did reach out to you. So unfortunately, I think B and I spend way too much time online on social media channels. And I remember reading lots of posts, and there was this doctor who kept responding to people's posts, Dr. B, and I just kind of liked his take on the world, and he wasn't afraid to be a little bit controversial at times and stir the pot. And I thought, he sounds like the kind of person who you would want in your back pocket when you're looking at innovation. So I reached out to him and said, look, I've got this community of clinicians who, many of them are entrepreneurial, who are thinking about startups if they've not already built one, or thinking about, sort of the business side of healthcare. And I was curious as to, what I could do to support that community. And I'd also worked in the startup space for a little while and realized that one of the challenges was actually getting access to funding. And B was running a group called Investing for Doctors. And for me, this was like, the perfect opportunity to bring entrepreneurs and investors together. So I just reached out to him, asked him for a coffee, and we met, and
here we are.
So it was a bit of scribbling on a napkin, trying to figure out, what we could build together. But we saw a huge gap in the market where healthcare or health tech founders were really struggling to get access to investors through traditional methods. So we realized that the traditional VC kind of structure may not work for all of them, particularly because a lot of VCs were quite nervous about investing in healthcare. You've got regulatory barriers, you have reimbursement queries about whether there would be a business model. We have complex systems in terms of how the system is funded, and just not understanding it. Like, I mean, I have to admit, sometimes when I get things presented to me, I don't understand all of the science because I'm not a specialist in that area. So we realized that we had a network of people who were specialists in areas that we could reach out to. So we just realized we had something unique in bringing those two communities together.
Yeah, I loved it.
Yeah.
And when was that? Which year was that? And how did you then trust each other to bring the communities together?
We've sort of known about each other for quite a long time, and I don't think anyone said anything bad about either one of us when we talked to
background checking.
Yeah, background checking. You know, absolutely. And you always sense check things, right? So you don't jump in on the first coffee, have a couple of meetings, have a chat, and everything's in a line. You just have to jump in.
And I think that's an interesting point you make about trust, because it actually extends to why all of our investors came on board. I think because we are one of them and, we're peers, and obviously we can kind of check each other out in terms of your registration and, through networks, there is an element of trust that was just sort of implicit of the fact that we were also fellow doctors. And I think if we had been some random people who decided we wanted to build a doctor syndicate but weren't clinicians ourselves, I actually think we would have struggled to build trust with our investor base. I think it was a fact that they knew about us. B should tell the story of the first investment because we did this all on Facebook. So
wow! So there was a Facebook group.
It was a Facebook group.
Yeah. So the both of us, we ran large Facebook groups, and then so we created a third group called Australian Medical Angels, and within that group we got a couple of people joining in who are, a lot of them were probably just curious about what's happening. And then when we actually put the very first deal through, that was actually a mental health software company.
Yeah.
And one of the comments after the deal went through was this guy just said, "We just gave this person basically a Facebook profile, X amount of money."
This random bank account.
Yeah, into this random bank account, which I think back then was one of my business's transaction accounts.
Yeah,
so,
right.
That was back in the days where everything was all very amateurish. And then he was like, "Is that a great idea, or this is like the perfect scam?"
Perfect scam, that's right.
Transferring a bit of money to somebody with a Facebook profile.
Oh no.
Yeah,
that was the early days. Wow.
Yeah.
Because you also mentioned like trust of you being doctors yourself. How did you manage that over the years? Like, I used to practicing as doctors. Yeah. How do you manage essentially the syndicate and the fund with your day jobs?
Yeah, I mean, look, it's a great question. We don't manage very well, considering B's just come off a night shift and doing a podcast. But I think for me, it's so important to still be on the front line. I think it's what gives us the edge, is that when I can credibly say to an investor, that I think they should invest in this company because I think clinicians will use it. If I haven't practiced as a clinician for 10 years, my word isn't really that credible because I don't actually know whether clinicians would use it. Whereas the thing I love about the mixing at the moment is that, like, I remember going into my general practice maybe 6 months ago, and there was this poster on the wall from the practice owner or practice manager which said, "We're now using this company for, referrals for genetic counselling. This is the company and this is how you refer to them." And I looked at it and I was like, "Oh my God, that's one of our investments from Medical Angels," and it was called Eugene. And it was just like a full circle moment. He was something that we years ago had invested in because we could see it was part of the future. And now it was entering sort of mainstream healthcare where it was being promoted to me in my own practical setting in a clinic. And I think that's what makes me, useful when I'm making investment decisions, is because I'm actually one of the users and I'm on the front line with all the peers that are the users. And I'm also talking to patients every day and knowing, what are the things that are important for them in the future. So I actually think it gives us a lot of credibility. I mean, obviously we've decreased that to quite part-time. Well, for me, I think B's gone, a lot less as well, because we are focusing on how we can help the health system on a massive scale rather than just one by one helping patients. That's the thing I love about the investment space, is that we can invest in something, spend some time with a founder and know that we're going to impact millions of patients and potentially globally versus if I spent that effort seeing one patient after another, my impact is still my local area in Bondi. It's not going to be at that massive scale. But I think we balance it, the best way that we can. But I do think that the roles are kind of synergistic in terms of bringing value to both sides.
Yeah, I love that impact that you can have and that full circle moment. That's just beautiful.
Yeah.
When it comes back to you. There are a lot of VC funds in Australia. Why do we need a clinician-led one? Like, what's the uniqueness here?
I think it's the clinicians. Yeah. Where we really see that is that investing in health tech, med tech, or the various verticals in healthcare, there's a lot of risks involved. And that is definitely much more than say a B2B SaaS or a direct-to-consumer company, which is where a lot of the typical venture funds came from. Because that's something that you can readily test your sales, your product and everything. Whereas in healthcare, that process might be years before you actually get to that first sales because of the regulatory barriers, the scientific barriers, or you have to go through clinical trials or things like that. And that expertise is actually not that readily available because the people doing that are often very, very specialized or subspecialized. And so without that information, it's very difficult for a fund to sort of predict or almost risk mitigate those sort of risks, right? Whereas I think one of our strongest benefits is that because, as Amandeep said earlier, we're the customer and we're also the end, we might be the end user, we might be the facilitator, we might be the prescriber for these kinds of investments. We actually know this space very, very well. And I think often we don't give ourselves enough credit about how much we know. And we just assume that what we know, other people know as well. But I think that often that's actually very, very different. And sometimes we know things that even the founders have not thought about or know about. And I think that's where that special dynamic comes in, where we can be actual active investors and help them get to where they need to be. And from the from the vetting side as well, we are able to almost risk mitigate a lot of the perceived risks because we know where those risk points are and we know exactly how to fix those risk points. Often, I've had these scenarios where a company reaches out to me and I almost instinctively think, this is exactly what I previously thought we need in this ecosystem. So it almost feels like we're already aware of their product or we know how their product is going to fit in the ecosystem before they even pitch the product to us.
Yeah.
So I think that kind of expertise, knowledge is something that is very, very different from a clinician-led fund compared to a more generalist fund or even more specialist funds that have analysts that work in that space.
Yeah. And you've got a community of over 50,000 doctors who you can actually lean in on, right?
Yeah.
From a customer perspective for those startups, but also from an expertise standpoint.
Absolutely. I mean, for due diligence, like really valuable to have subspecialists in particular areas. And you and I know we sit on a grant committee together and sometimes you spend, days just trying to delve deep into a particular subject matter because you're like, I know nothing about this area. But the great thing about us is we might not know a lot because we're, still quite generalist in terms of our specialty areas, but we can find, a pediatric neurologist who has a special interest in that particular condition. And we can find them easily because we have that network. Whereas I think for a traditional VC to try and find a specialist in that area easily is really a challenge. So I think it's having that network. But the great thing is when we do that work and we say, okay, we are now happy to invest in this company, it actually can help unlock capital from other VCs. So we often get other VCs that say, if medical angels have said it's a product worth having, then we don't need to necessarily do the clinical due diligence. We can come off the back of that. So even though we look at, what we've deployed over the last 5, 6, 7 years, and it might be a modest amount in terms of like actual financial, like the dollars, it's actually contributed so much more because it has given those companies that validation. It's allowed them to access other capital because they've said we're involved. It's allowed them to access our customer base, our investor base as customers or as key opinion leaders or people who can open doors for them and help make the right connections. So I think the value goes much deeper than the money. I think the money is like almost the least exciting part. I actually think it's the other value that we bring, but the money helps connect that or build that relationship.
Yeah, and it's the impact you can actually have with it.
Yeah, absolutely.
Because you're mentioning that you traditional like the bigger VC funds almost come to you for validation, and you become the signal in healthcare, so which is super exciting. I mean, the common startup attitude is almost the one of like move fast and break things. How does that work in health tech? How do you think about that part?
It doesn't work. I think that's the difference, right? Is that when you break things in healthcare, people can get harmed or people could die. And I know it sounds really dramatic. People are always like, oh my God, you're so dramatic. It's just a startup. But I have seen technology products. I mean, we recently had, a case in the media where it was a virtual care service, but a patient was able to, shop multiple virtual care services and they didn't all share information with each other. So they managed to accumulate a large quantity of medication, took an overdose and died. And so, we can sit there and say, what is the harm in having a virtual care service? Like that's just a telehealth, like a Zoom platform. That's not actually killed anybody. But that access that it's given and the fact that the information didn't connect means that somebody gets harmed. And so for us, we're constantly looking at everything with a harm lens. And, we absolutely believe about, that we have to be agile in the startup space, that you have to be prepared to pivot if something doesn't work, that you have to move fast because obviously we're seeing the rate of development of technology now is exponential speed. But we bring a governance lens that helps people do it in a safe way that doesn't harm people. And I think it's hard sometimes for other investors who are a bit more agnostic about industry to understand how you navigate building in health tech, because you've got to be fast, but you've also got to be safe. And how do you do that at the same time?
Yeah. Wow. Love that. And I felt like the next concept is so perfectly aligned with your fund, which is painkillers versus vitamins, which is often like this thing where you say when we evaluate startups. Do you have any examples there of how that plays out in healthcare? Because obviously you've got so much expertise there. You've got so many doctors you can lean on. Yes.
I mean, we can both.
You've got some
share
stories
some
there.
Examples.
Yeah.
I'll go with the very first company I ever invested in personally, and it's a company called Metaska, right? Essentially, it's an enterprise software for large hospitals. And what it is essentially a task management system. Sounds very boring, but you got to look back on what doctors do. If you look at some of the films and movies and TV series, doctors are still operating on paging systems. And what they're trying to do is basically replace the pages. And it might sound like it's an easy thing because everyone has mobile phones, but one of the crazy things is that hospitals are not built to be digitally connected long time ago. And there's still systems that have to run on paging because it's an emergency system. And if that fails...
There's no reception in a lot of hospitals.
Yeah, if you don't have reception, you basically, if you have a code blue, for instance, that means if someone needs CPR or can't breathe and that sort of thing, then the message needs to get to the people who need to be at that event. So that's been a major thing that has stopped this sort of people from getting onto their devices. But this company has sort of more or less solved that problem. And that's an absolute painkiller because what we learned is that later on is that the paging system is actually not foolproof, because as telecommunication companies sort of divest from the old paging systems, they're retiring 2G, they're retiring 3G, and some of the paging systems rely on those antiquated hardware. They're actually starting to fail as well. That's an absolute painkiller because nobody wants to carry around 3 pages. I used to remember when I was, say, in charge of a number of wards. I would have 1 pager for myself. I would have 1 pager for the specialties, another specialty I was covering, and then I have a third pager, which is the arrest pager, and you're just running around with like 3 blocks on your belt. And now that can be just replaced with a mobile phone app that actually works, because now hospitals are more connected. And I was like, I mean, that's an absolute painkiller.
Yeah.
I think one of the things that you've raised, though, B, is that there are a lot of unsexy problems in healthcare to be solved. We are still one of the biggest purchasers of fax machines, out of all industries.
Wow.
I remember I was working at a clinic in the Google offices. They set up a GP clinic for all the staff there. And I remember trying to refer a patient to a hospital nearby. And I tried to do the referral by email, and I got a response back saying, please fax this referral. And then I tried to, I said, well, can I print it out and just give the paper? No, we have to fax so we can triage it. And I walked around the whole Google office, all the different levels, and asked if anyone has access to a fax machine. I must have just looked so crazy. But this is the world that we work in. We are still in a very, sort of paper-driven, fax machine, pager, environment. And at the same time, we're talking about AI disrupting things. And so you have this cognitive dissonance, I think, when you walk around in the current healthcare system, and then you also work in healthcare innovation. And so I always say to people, like, it's great that you come to me with all the whiz-bang, flashy, AI is going to solve X, Y, Z, but solve some of the really core problems for me in healthcare every day. And some of those companies are going to be the ones that will, be the big money spinners, right? It's going to be the Stripe, right? Everybody needs it. It's not like everyone gets excited about Stripe, but you all need it. And we've had a few of those companies that have come in and solved it. I mean, I literally was talking to somebody yesterday where their business is based around queue management for hospital outpatients. And they're making a lot of money in that, because how many of us are sitting there waiting, to get an outpatient appointment? So people are waiting 6-18 months longer. And it's such an inefficient system. People don't turn up. They get sent letters in the mail. If you miss the letter, you miss your appointment. So just even managing some of those basic things in healthcare are, such valuable companies, which I think some of the other non-health focused investors would miss that, because they'd say, oh, that seems silly. Like, of course we've solved the fax problem or the pager problem. And so we've really been lucky to be able to identify some of those unsexy things that need to be solved.
To me, it's amazing because you've got the lived experience of what the world looks like in a hospital and a clinic.
Yeah.
I'm actually really curious about this one, because it was the go-to-market strategy in a way. Is almost a differentiator of how do you bring that innovation into a hospital or into. Do you have any good examples of founders or stories or things that you or your network has helped with to get a founder into a customer?
Yeah.
Like, who does it incredibly well, or what are the strategies there?
It is difficult. Hospitals have long sales cycles. Getting into procurement processes when you're a small company and a startup is very challenging. And every state, every hospital system has different procurement processes. You can't use the same thing that you've used before. It has been really difficult. But I think what we have managed to do with some of our companies is find champions. So there'll be clinicians that are in an investor pool or in our networks, where they sit in a leadership role in an organization, and they can take that company, to the executive or, to any of the forums where they make those decisions. And sometimes what they've been able to do is actually work with that company to design the procurement. So actually write, the procurement that's going to go out, and then they can respond to it. We've had a few that we've had. I mean, UPage, for example, is a nurse workforce management tool which helps recruit nurses. And during COVID, we had a lot of requirement for nurses across the health system. And every time we spoke to someone in the health system and they would say, we're desperate for nurses, we'd be like, actually, we've got this really great companies in our portfolio, and we'd connect them. And so there was a lot of recruitment of nurses during COVID that were all done through UPage. And so we've been able to take, we've always got the company at the back of our mind when we're going into any of our meetings or discussions, in other roles. And also our clinicians who are investors are doing it every day. So they're thinking, I'm an investor in this. And, CoView, for example, was the telehealth platform that was used during COVID. And again, every time we're in conversations with organizations that need virtual care solutions, it's a company that we've invested in that there's got a lot of doctor backing and was endorsed by the government. It's a main platform used by government. And so we've had a lot of companies that we've gotten into mainstream healthcare that have come through our network or through our contacts and our everyday interactions with the health system.
That's amazing. I love that, because you're not just being the signal here. You actually are able to plug those founders into the right networks to even help them with the success.
Yeah, absolutely.
I'll just add on to something, because there's always two ways. There's the getting with a leadership to go in at the organization level, but one of the other things that we've also seen is the ground up, where you on one side is like you have to just go big, and then on the other side is that you just go so small that you fall within your a unit or a department's discretionary budget, so it doesn't even land on the table of someone who doesn't understand what they're trying to sign off. And in that way you get the grassroots support. They get in one department, two departments, three department, and then suddenly the powers that be look at it and say, oh, okay, these guys
these
are all
people using
it.
Oh,
so maybe let's do a whole program around it, or let's do a procurement process that you just buy on bulk for everyone to use. So it's been, finding those ways of getting into different places has been quite an interesting journey. But obviously we've done it a number of times now, and we've seen some of the successes, and we've seen where things don't work as well. And I think that's also one of the key strengths of our group.
Amazing. And for the founder, invaluable to actually know those thresholds of when you don't need that sign off. Really specialist knowledge.
And from a regulatory perspective as well, because a lot of companies, they believe that they need to have a certain level of regulatory requirement, but it also depends on what you're trying to claim at the same time.
If you're
and the
doing
language you use.
trials or pilots or whatever, there are ways that you can get around, not get around the regulatory environment, but be able to actually get your product out there and start using it and get it in the hands of the users without having to spend, significant amounts of money, time, resources on going through lengthy processes. So those are all like tips and tricks that we've learned over the time. And I think it's also about your portfolio, then you can connect them. So there's a lot of connection between the portfolio companies where they might have synergies or they'll learn from each other. And particularly around a lot of our companies have started to go, global and are, setting up entities in other countries and, trying to enter new health systems, because that's challenging. And even though we may not have the personal experience of having done that ourselves, we've got, other founders in our network who've gone, I've got into this health system and I can show you how to do it, or have been able to bring them in. So we've got that real community feel around them.
Amazing. With 32 investments that you've done so far, none of them have died. So you've got 2 exits already. What do you do differently in the selection stage? I feel like no other VC would be able to even claim that no companies have died in their portfolio. Like, is there something different that you did in the screening? Is it the expertise that you have? Is it the network of doctors? I'm just making assumptions here, but I'm very curious to hear.
I don't think it's just the selection. So I think selection is one part of it, right? So you can select really well, but sometimes you've got no control over what's going to happen. But I think it's about what happens afterwards. So when we've had companies that have said, we've really hit a wall here, or we've, there's been a downturn in this sector, or this model's not working, rather than us going, actually, we've already picked the top 5 companies in our portfolio that we're going to spend all of our time on, and the rest are kind of written off in a way, because I often find that happens. We dedicate time to each and every one of them, because we're like, we actually invested in you because we believed you had a solution for a problem and you were the right team. And it might just be that you need a bit of tweaking. And we've done that. We have tweaked. We have worked with companies and changed their product quite dramatically with them, because we realized, you're right, something hasn't worked, but doesn't mean you're dead. We can actually pivot this. So I don't like the word pivot, but, it is actually modifying the product to fit, what the market is telling us it wants or needs. And we've had some difficult conversations with founders who've had to scale back. I have sat there and worked with founders who've had to sack a bunch of people and say, we really need to refocus. And but then they come out stronger. And we've had a few of those that did that, particularly during that downturn that we had. So we never really abandon them. I think that's the other thing, is that we always go, we picked the right team, we picked the right area, we picked the right, sort of product at the time. Now let's see how we can pull those things together to make sure it's something that can continue to survive and actually solves a problem. And so I think we've done that quite well with quite a few companies. And then also we can lean in and actually help them. So it's then finding the right connections, helping them build the right teams, helping them, get into the right market. So I think in a way we have saved some of them, which, in another setting, another VC setting, we might have just let them go.
Yeah. It's a very sink or swim approach in a lot of VCs.
Yeah, no, absolutely. They, I personally view all of them as necessary in the healthcare system, or they're needed. Otherwise, back to the original question about painkillers, they're all trying to solve a particular problem that we experience or we know that exists in the healthcare system. So to let them just sink or swim or perish is, to me, that feels like it's such a shame for that to happen, because somebody has already dedicated the time, the capital, and a lot of things have gone into something to solve a problem, and you just let that die because it wasn't doing as well as you hoped it to. So in a way, if a company survives that solves a problem and it gives not what we would typically consider a venture scale kind of return, that would still be a win for us, because we've actually solved something that is worth solving.
Yeah, our expectations are different. I think, you made a really good point there. Of course we're commercial, and of course we're going to, deliver returns, but I don't think we're at, we're a bit more patient in terms of the returns. And other people say they get pressure from some of the other investors about, you must show this, hockey stick exponential growth thing. And we're like, we actually want you to do this safely. And if we have to wait a bit longer and we see the growth happen, a bit slower, that's okay, because we still know you're on the right trajectory. And in the long run, your company's going to be sustainable versus going really fast, breaking things, killing people, and then you're dead and there's zero value for your company. So I think that feeling of bit of patience with them, and obviously we're lucky that our investors behind us also get that. They're not sitting there going, hurry up and show us the money. They're saying, we get that healthcare is a long-term game.
Yeah. Well, let's talk about financial returns actually, and the exits. You've had 2 exits already. I would love to hear the telecare story of a company that you've backed all the way at the beginning and then getting acquired.
I think when we first met them, they were
it was during COVID. Yeah.
And that was a very different company then compared to what they were when they exited. And I think one of the so for those that are not aware, telecare is a specialist virtual service provider, and I think when we first met them, they had nearly every specialty under the sun, and even some procedural ones where they were able to allow patients who are in lockdown to see specialists, and also solves another problem in Australia because of our geography. There's lots of patients that can't travel during lockdown, but also just the tyranny of distance prevents them from getting access to good healthcare, because you might not have certain specialties or subspecialties anywhere near the town that a patient is living. And so we saw that as a key solution to the tyranny of distance in Australia. And we all knew that was going to be the way that we bridge these sort of gaps within Australia. But then now there's finally a company that was doing it. And so when they first approached us, it was just like, yeah, there's something about this that is really right. But then there's also things where we needed to make sure that they, ended up in the area that we wanted them to, because there's lots and lots of telehealth companies popping up during COVID.
How do they differentiate?
Exactly. And how do they make them, how are they different from every other company that comes through? And one of their secret sauce that when we identified was that they've actually built software and a whole back-end system
to support the virtual care.
Yeah. And that, I think that was the key. But they didn't even sort of pitch that to us.
The value they were focusing on was the actual services part of the business, but we saw the tech side of the business as what was appealing, because we figured you could even sell the tech without having the virtual care services, so people could use the tech in a normal clinic setting. And they were building some AI products as well. And I think we really saw it as a technology business, and they saw it as a services business. And so I think if they had pitched to other VCs, which they did, and people just saw the services telehealth part, and a lot of people get nervous about that because they're like, limited pool, expensive resource, how do you compete with other, service businesses? It's less appealing, whereas, tech, everyone gets a little bit more excited about scalability and, SaaS. And so we think that if they'd pitched slightly differently, they might have had a different, sort of response. But we could see that, and our investors could see that. So we were in a very lucky position. But it was also about, could we work with these founders? Like, are they the type of people who would take feedback from us about what we think the market needs and help design and build things that we really see as the future? And I think that was the most exciting part, was there was just such a lovely team, and we really wanted to work with them. And we were very lucky to be able to work with them over the years. And we also helped them get some funding through LaunchVic with that Alice Anderson fund. But they really struggle with any other VC sort of seeing past, oh, you're just a telehealth business. But to get an exit in 5 years in health tech is from, an international player is pretty phenomenal. Like, for them to get, to grow that quickly and get the interests of a company like Teladoc.
Oh, absolutely love that. And I love the whole story of how you supported them throughout the way.
Yeah.
And in particular, seeing the side which they didn't see themselves. Let's dig into another story. The story of Clean Slate is another beautiful story, which I would love to hear.
Clean Slate is actually interesting because it is actually a service delivery business.
What does it do?
It delivers alcohol detox and rehab in a virtual setting. When we first saw it, I was like, oh, that is really, really interesting, because typically alcohol rehab has been done in inpatient models of care.
So you have to go into a hospital setting to get to
and
detox,
you got to commit to that amount of time. And when you're in that clinic, you basically are not doing really anything else. You're in a sterile environment where you don't have access to your daily life routines or access to alcohol, that sort of thing. And so when we saw that model, even though it was a service delivery model, the pathway and the logistics in which they delivered it was actually very unique and very scalable. So yeah, I think when we saw it, it was just like, oh yeah, this makes absolute sense. And the amount and the unit economics per patient that they could deliver such services was a fraction of what the inpatient model could do.
Yeah, and there's so few inpatient beds available. So if you get a patient who's ready to detox, I mean, imagine coming in, deciding, okay, I'm drinking way too much, I want to stop, and I want to stop today. And you go to see your GP. The GP's like, the wait list to get you into a inpatient facility is 6 months. Come back in 6 months. And that is a reality. And particularly if you're in a rural area, like, you would then have to travel, for hours to get to a facility. And so you weren't actually able to catch people when they were most likely able to detox effectively. And so this model, and it was also the founders, again, like, I go back to the founders, I was like, this would be a dream team to work with. Pia is a health economist, and she's also got lived experience. So she actually designed this program for herself to help herself, detox. And she partnered with Dr. Chris Davis, who's an addiction specialist who deals in alcohol detox. So they're really good friends, solved it for each other, and then decided to build the model around it. But the interesting thing about them going out and pitching this to other people was that some of the feedback from the VCs was that, this isn't a recurring revenue model, because once you cure somebody, they're not your customer anymore. There's not really a lifetime value to that customer past you putting them on the program for 12 months. And so because they didn't have this annual recurring revenue, some of the VCs were like, nah, don't like the business model because you're curing all these patients. And I remember them
Which is
coming
ludicrous.
to which we were just like, what? But the business has grown so much. It is the number one, the largest alcohol detox provider in Australia now, because it's able to provide it for every patient, whether you're the back of Burke or sitting in, urban city in Melbourne. And they have grown so much. They've launched in the UK. They, they're double-digit millions in revenue. Like they're doing incredibly well, and they're not running out of patients. So let's just say they are not going to run out of patients in their lifetime, because for every person that they cure, there's a whole bunch of kids who've just taken up drinking. So I just say to the VC that turned them down for that reason, I look forward to the day when they exit and I can say I told you so.
And I think I want to bring back to that whole, we view these companies very different, because on a traditional VC model, that looks like a bad company to invest in, because they think about cost of customer acquisition, and then the churn is like nearly 100, it's not 100%, but it's like nearly 100% at the 12-month mark. So when you put those metrics together and they plug it into a traditional VC system that's based off software SaaS, it doesn't make sense. So we view that we can't use those same metrics we used to do due diligence on companies, because in healthcare it's just completely different. This service is very much supply driven rather than demand driven.
Yeah, and interestingly, the most successful channel they had to acquiring customers was Facebook. The number of people that scroll Facebook late at night probably had a few too many drinks and gone, oh my God, I need to stop. And they were paying out of pocket, and they're willing to do it. And so we've discovered some really interesting things about, health behaviors through working with them. And then obviously been able to use some of that experience for some of the other companies that are also doing direct-to-consumer models. But the other thing I think the other VCs may not have picked up on is that the model that they were delivering is also applicable to a whole bunch of other addictive substances. So you could do the same for opiates. You think about in the US, the massive problem they talk about around, people addicted to toxic content and endone and things. But you could do it for any drug of addiction, and a similar sort of model where you detox people virtually in their home environment. And also, the other really great thing about that business was that its success rate of actually successfully detoxing people was higher than the inpatient traditional model.
Much higher.
And because you're in your own environment, you learn how to manage those triggers, which are all absent in a hospital environment. So it's not only that it makes commercial sense, it's scalable, it improves accessibility, it also delivers better health outcomes, which is something that we're constantly driven by. Everything we invest in has to have a social impact as well to the health system, either from an efficiency perspective or cost or clinician experience, but most importantly, patient outcomes. And that's why I feel like we do have a little bit of secret sauce where we know those things that are really going to make a difference to the system.
That's why they were so successful, because and that's why they didn't have ARR. They don't have the recurring revenue because they killed all of them.
Curing everyone, yes.
So the key differentiator is that you actually want to cure your patients. Rather than not curing them.
Absolutely.
Is there any other stories in your portfolio that are surprising, that a company which should or shouldn't exist?
Yeah, I think,
any of your favorites?
I think one that we are currently sort of in the process of raising for, which is Neogenics. Even though we are heading towards a fund-led model, our syndicate has actually also grown to be a lot more complex than it originally was. Because as a typical angel syndicate, you'll have a company that approaches them and they'll get a couple of their angel investors, pool money together and invest. But we've actually now have 3 different segments for syndication as well. So one of the first things that we've actually now doing with companies is that we are catching them earlier and earlier. Sometimes even when they're doing the family and friends round.
Amazing.
Because one of the biggest pains that we see in the investing circles is that companies that go and do the friends and family round, if they haven't done it right, it creates a tremendous amount of problems at the cap table level and structuring.
Messy cap tables.
Yeah, and you get very messy companies. So what we've actually done now is that we've actually gone even earlier than a typical angel syndicate would go into, to actually help them at the friends and family round, and also help them structure it through our entities to allow them to become much more sort of professional at the earlier stage. So that's one of the things that we've done, and we're currently doing this with 2 companies that we will likely put into our fund. And I think that
About neogenics.
yeah, and so back to the neogenics, we've actually syndicated a number of their sort of colleagues and people who are engaged with the company from a very early stage to allow them to unlock that initial capital. And then we're going to be releasing it onto our sort of angel syndicate investors within Medical Angels. And then at the same time, we can actually allow, if there's any sort of allocation left for more broader audience within our networks. So, Neogenics is actually a company that was a spin out of UTS, and they look at sperm selection. And they got a microfluidic device that helps select sperm through a non-violent way. Because how we typically isolate sperm for IVF, for instance, we have to spin it through thousands of G's of gravity to actually separate everything. And that process actually damages the DNA and the sperm itself. So what they've now done is able to do that without that harsh spinning, by just allowing the sperm to swim within their devices.
Amazing.
All right. Now, the interesting thing is that that's where they came from. But during that development, they've actually developed a computer vision AI software to help
find
sperm
super
selection
swimmers.
as well. To find the sperm that are more motile or healthier looking, and also to find sperm in, for example, testicular tissue that you wouldn't have found very easily with the naked eye.
Wow.
So for those who have like really, really bad sperm count, it's not just that they can't swim, it's just that they don't really exist. You can't find anything. So what happens in that situation is that a patient will actually go under the knife, and they have little bits and pieces of their testicle being biopsied and put on the microscope, and then they start searching for sperm.
Wow.
And and as they were building their device stuff, they realized that, hey, there's a software play here as well. And they've now built that out. It's in multiple countries. They actually have patients that manually they would have found 0 sperm, but with their
now
software,
had pregnancies,
Incredible.
babies.
they would actually have pregnancies and also live babies born because of that technology.
Wow.
And so that's something that feels very good, from an investor, and supporting that journey.
That's
so when
amazing.
we first came in, it was a device. Now it's software, and now we have like babies born.
Yeah. And the impact you can have there is just unbelievable. Yeah,
It is.
loved it.
Yeah.
Jeez, thank you so much. I learned something new here.
Yeah. I mean, the slogan I told him is like, use our software, save your testicle.
Perfect.
I think there's so many funny terms we can come up with for that company.
Yeah, absolutely. Absolutely.
Well, let's turn the conversation to the funds. So you're going to formalize the angel network that you have, the syndication that you've done now, into a formal fund. For a doctor who's never invested in a venture capital fund before, like what does that mean? What are they signing up for? How does it work?
Yeah, I think the main thing that's very different from sort of traditional retail investing, of which there are mainly just a property and index-based fund, is that think of a venture fund as investing in, similar to investing in public companies, because it's the equity base, but you're investing at a much, much earlier stage, and it's just a bit difficult to trade it in a way. And that's done not directly into a company, but into a fund structure where the fund helps you select them and manages all of that. So it's an actively managed asset, but it is done at a much, much earlier sort of stage of a company where we believe that's where all of the growth happens. Because by the time it gets to the $1 billion mark, companies, they can still grow, but it's up to the public market's whim. And so this is very much the private market side of things. Now that's one thing for doctors, but the other thing that excites pretty much every doctor we speak to is that the tax benefits from investing in a venture fund like ours. So as we were setting up the fund, because we invest in really early stage companies, the Australian government has this incentive called the Early Stage Venture Capital Limited Partnership Fund, which any investment that you invest in that fund, you actually get tax offsets of 10% tax offsets based on the amount of money that has been invested in eligible investments in that fund, and you don't pay any capital gains on exit. So basically, it means that you get a 10% discount on whatever money you put in, and at the end of the day, you're not charged a capital gains tax.
Incredible.
Now, we are heading into the budget, next week. So we're recording this in May 26th, and as part of that budget, they're talking about revamps to the capital gains tax discount and all that sort of thing. So comparatively, when you have a investment asset that you don't have to pay capital gains tax on versus the others, that might comparatively become a lot more attractive form of investment. Now, not everything is cherry and roses, but the main thing that people have to consider is that when you invest in a fund, it is a very illiquid asset. So that means you can't say, oh, I want to invest today, but no, tomorrow I want to pull out. You can't get out of it that easily.
Yeah.
So to a doctor that's not invested in these sort of illiquid assets, I think the best analogy is think about it like a property where you can
set and forget.
Yeah, you invest in it not because you want to get out of it in a year or two, even though you can, but you invest in it for the long duration. Yeah. And a typical life of the fund is about 10 years. So you just got to think about, I'm going to put some money in here, it's squirreled away, and I'll see it on the other side. Yeah, you get a nice surprise either along the way or towards the end of the fund where everything gets paid back. So I think that's the main thing.
Yeah, right. So as soon as I invest, I get 10% of a tax offset, and then 10 years later on my profits, I actually don't even get taxed in the first place.
No, you don't.
And how does it then work? So I, as a doctor, would invest $100,000 into a fund. Do I just need to hand you the money straight away?
No. So that's another thing. That's the $100,000 is a commitment to the fund, and as we need, we're not gonna say we're raising $40 million fund. We're not going to call $40 million immediately because
we can't spend
it all that quickly.
Yes.
And so what we do is that if you commit $100,000 as part of the fund, the first payment tranche is 20%. And roughly it will be about 10% or so every sort of 6 months we'll call for additional fund. So it is very much like dollar cost averaging, where you put bits and pieces in through a fixed amount of period of time. And usually with a venture fund, and what we're trying to aim for is about between around 4 years. That's the sort of the period of investment. So that gives people a very sort of stable and staged way of investing in that money. And the tax offset also sort of comes on when the money sort of goes in and gets invested by the fund.
Yeah, right. So you spread it, the $100,000 over the 4 years.
It's not a lump sum investment. Yeah.
Got it. And what kind of returns can people expect? There are 10-year kind of vehicles. How do they compare?
We obviously want to be the fund that outperforms, the average fund. And so I think in the venture space, we're typically looking at anything north of 20% sort of annualized return. And that annualized return, I got to put an asterisk there. It's not from the commitment amount, it's when your money goes in. So when the money goes in over a number of years, there's some complex maths. So every year the money you commit is supposed to compound and grow. And the way we say is that we're aiming for over 25% on an annualized basis. Yeah, and that's obviously after net of taxes, which you don't really pay any much of.
Yeah, I loved it. All right. Well, let's assume the fund is incredibly successful. What does Australia look like in 10 years' time? What impact have you had?
Look, I think for us, we want to see a real material impact on the health system. We think we're going to do that through innovating in the next generation of, health technologies and innovations. And so for us, we want to see our companies, we obviously want to return money back to our investors because they've backed us. But we also want to see a long-lasting impact, and we want Australia to be known as the exporter of great healthcare innovation. We've already seen some great things, whether it was like Gardasil or Cochlear come out of Australia. We'd like more of those, and we would like to be the early backers of that. And we're seeing companies like Heidi do very well. And so we just want to be known on the international stage as a country that punches above its weight in terms of innovation in healthcare, but also just to expose our doctors and our investors into this early stage space, because they can influence and they can have input. And I think a lot of them are finding it really exciting to be exposed to this type of investing, which they've never really had access to before. So it's kind of twofold. It's like helping them and, giving them returns and something interesting to invest in. And then obviously helping from the impact perspective and filling that gap for healthcare entrepreneurs who traditionally have struggled to get access to capital, for them to say Australia's a great place to be able to raise money because we've got great funds like Medical Angels.
Yeah, absolutely. I some of our earlier companies we are already seeing the impact that they are delivering. Like Telecare, which was sold to Teladoc, that's running sort of outpatient services in some regional and rural hospitals, for instance, right? CoView, which is the telehealth platform, that basically saved us during COVID because they were the platform that was given to every hospital, GP practice to enable us to do healthcare, telehealth. Yeah. And so we've already actually seen some of those impacts. And
like Vantari, that's training the next generation of clinicians using VR for how to do medical procedures, and they've relocated to the US and have got a great footprint across the US already. Again, it's like Australian innovation that is going global. And as we mentioned with Clean Slate, we've seen Smiley Scope is another one of ours that's in the US. And so we're seeing a lot of these companies now really start to make their strides on the global healthcare systems, and so that is exciting for us because we want them to to be able to access the scale that they can at that level. But we just want to see more of that and faster. We're just impatient.
Yeah. And right now with, the growth in AI and the evolution of, genomics at scale.
There's so many exciting
things that's going to happen. Yeah.
It's like the perfect time to be coming in when we're just at this incredible inflection point where we're going to see technology be adopted quite rapidly into the healthcare systems. I think in 2024 in the US, they found that 66% of doctors were already using AI. It's in 2024, we're already in 2026. So, we're going to be getting to 100% pretty quickly. And you want to invest early in those things that are making the biggest difference.
100%. And both of you are practicing doctors. You're on government boards as well. You could spend your time on so many different things. Like, what excites you about this? Why are you doing Medical Angels? Why are you running a fund? I'm really curious about your personal kind of like motivators.
Amandeep alluded to this earlier, where treating a patient face to face, that's one patient at a time, right? And we know that by running a fund, helping these startups, we can impact so many more people. I think that's something that's very exciting and something that I really enjoy, because seeing the impact that the startups that we invested in or helped have impacted so many more people beyond what our immediate reach are. I think that's important. Now, the second thing is that we also want to almost grow and safeguard healthcare in the right direction, because as we all know, there's a lot of corrupting influences of money in any system. And healthcare is one of these things where I believe is really precious, because it underlies human lives, right? So we want it to be doing the right things for the population and the country and humanity at large, because there are a lot of things that we can actually do a lot of harms if we didn't get that governance side.
Yeah,
right.
Like genomics and what you could do with
information.
And we need to be involved in that.
Yeah, absolutely. Like say Gattaca. I'm not sure how many people have watched that. That's like a dystopian future where genetics is underlying everything, and there's not enough governance. So your fate was determined at birth, right? And then we have to ask ourselves, is that the kind of future we want?
Yeah.
Or is there some sort of safeguard or some sort of middle ground? How do we use, all these life science technologies to our advantage and not become some dystopian future that we see in the movies? And I think that's something that really strikes for me, because our Australian healthcare system, it has its pros and cons, but we're one of the most efficient systems out there and effective systems out there. So when we always compare ourselves to an NHS on one end, and we compare ourselves to the US on the other end. And I don't think anyone who's living in Australia right now wants our healthcare system to become like the NHS, or want our healthcare system to become like the US. So how do we navigate that carefully and avoid the pull towards one side or another, which is what we are actually seeing in the sector right now. There's a lot of influences, and I think that's also something we really take to heart.
So the impact you can have on people and writing the future together. What about you, Amandeep?
Look, I mean, it's similar motivations. I see so many problems in healthcare that I think, oh my God, it's such an easy solution. It's not that easy, but I get excited and motivated by people who want to solve those problems. I think one of the best parts about working in this sector is the kind of people that you get to work with. So like some of the founders that I've worked with have now become like some of my closest friends, because just it's infectious hanging out with these people who are building the solutions that are going to protect, the future health systems that are going to look after our children, our children's children. But they're doing it and to do it, you have to be in it for the right reasons. And so you really attract these like-minded people who are very socially driven, who are about impact, who are not just, purely commercial driven, but are commercial. And I think being around those people just makes me excited every day to be in this sector. And I think I'm in a privileged position that I get to work with them. I don't have to do the hard slog of actually building the company, but I get to hang around their aura and, be part of their success. And I think that's what makes this job like an incredible one to do, where we just, we live off this stuff.
We're the cheerleaders.
We're the cheerleaders, absolutely.
I love that. And final question for any doctors listening, what would you like them to take away from this conversation? What do you think they might not know that they should know and walk away with?
Look, I mean, I think it's broader than doctors. So if anyone else is interested in supporting the healthcare innovation of the future, I think getting involved in the fund is a great way to feel like you might have always had that idea of something that you want to build, but never been brave enough to do it, or been in awe of other people that did it and thought, how could I help them? This is a way to help them. This is a way to say that you also put your stamp on the future of the healthcare system, because you were the one that helped back them, supported them. And also you can shape, what our future should look like. And I think, by being involved in the fund, being able to see the things that we invest in, being able to be part of a wider advisory group, that we can reach out to, be part of due diligence processes. I mean, there's so many ways to get involved. But I think coming on as an investor, as an LP, is a great way to get, you dip your toes in it. And you'll realize like the addiction that we have to this space is real. And I'm sure other people will get there too. But I would just say for anyone that's really interested in, a good, solid investment that has some great tax benefits, obviously speak to your own accountants about specifically to you, but to get that, but also have exposure to this incredible industry, I think, to do both, this is a great place to do it.
You've already stole some of my
sorry
some of my lines, but I think working as a clinician every single day can be quite a frustrating process, and I think one of the biggest things that you'll come across by being an investor or going on this journey with us is that you actually feel empowered again about your profession, about your career, about your specialty, because you actually get that infectious vibes from the founders where healthcare can be heading. I think a lot of people just see what we have today and the technology that gets pushed on us and the changes that happen without being engaged in.
They don't see the vision.
They don't see that vision, because healthcare is something what comes to them rather than them bring to the rest of the world. And I think that empowerment is something that I have sort of recognized within myself, and I would love to share that with my colleagues. And yeah.
Love that. Well, thank you so much. I think on the website you've got this beautiful line of the money follows the medicine, which is a great guiding principle here. Sounds like the fund is open. The minimum commitments are 100K. First call, I believe, is 20%. And all of the information is on metaangels.vc. But yeah, super excited to see this take off and all the impact you're going to have in the future. Thank you so much.
Thank you.
Thank you so much, B.
Thanks
you.
so much.
This podcast is for educational and entertainment purposes only. The information and opinions shared are not intended as personal financial advice. The content presented should not be relied upon for making financial investment or other decisions. Listeners are strongly encouraged to seek the advice of qualified financial or legal professionals before making any financial decisions. While we aim to provide valuable and accurate information, we make no guarantees regarding the completeness or accuracy of the content. Any reliance on the information provided is done at your own risk.